Hi, Kendra. Thanks for joining us today. I'm so excited to have you here and to be able to give the wealth of knowledge that you have to the attendees. Can you give us a little bit about the background of what you have done in the past and what you're doing now?
Sure. I actually graduated from hygiene school in 1993, so now I'm aging myself. And I practiced as clinical hygiene until 2011 when we moved to Illinois. But that being said, within my clinical practice, I worked with prosthodontists, perio, cosmetics. I was really always in kind of specialty hygiene. Um, and from that, I had a temping service. I was in sales and consulting for perio. I did a lot of different things. So I've had a long career path, and practice management. Gosh, what else have I done? A little bit of everything. I've been fortunate to have really great doctors who have led me along the way and allowed me to grow. Um, and now I have my own business on medical billing. So um, it's been quite a path, quite a journey. And I think it's one of those things that one thing leads to another, and you kind of this is where I will end my career, is in medical billing. I'm not in the chair side position anymore due to some physical problems, but now I'm on a different advocacy area for patients, which is really cool. And it's great to see patients get the services they want, the treatment they want, and the treatment that they need and deserve.
I've noticed that so many of the participants of the program have talked about if they're a hygienist, and most people have been a hygienist in the program, they talk about all the different things they've done. So, and I'm laughing only because so many times online, hygienists are like, all we could do is hygiene, teacher, be a pharmaceutical rep. And it's just like, there's a long list. You just named, I don't know, probably about 10 careers. And so many different things that people can do. Can you give us a little insight about how one can get into medical billing? So I see a lot of times people in Facebook forums, they're really interested in that because maybe they assume it's something that you always can stay home and work and do. I've had some friends who gone to school for it or whatever. And even with the pandemic, so I even know some coworkers who worked, they were admin and they wanted to be able to stay home and help doing
Sure.
that billing. So how does one kind of get into that?
I got into it because I attended a course 4 different times by the same doctor on medical billing. And I could see the attendees, they were either the doctor by themselves, maybe an admin person by themselves, or maybe they were together. But I could really see um, the overwhelm of going to those immersion courses. Great, great, great information. And I took so much away. Clearly, I loved the idea because I attended 4 different times and I got to know the doctor. And I finally approached him and I said, how many people actually come to this, and do you think they successfully implement this into their practice? And he was very candid, and he said, I think probably very few actually implement it. And I said, it's great to talk about this, it's great to go to CE, it's great to do all that, but what do you do with it? Do you do anything with it, or is it just knowledge sitting up here that goes nowhere? And I was very much about elevating our profession, elevating our patient care, elevating our what we do for our patients and advocating for them. And I said to him, I said, have you ever considered an implementation type program? And he said, I have, but it's not something I want to do. At that time, I was in practice management, and all I heard about medical billing is this: we tried it, it doesn't work. And I was like, it's got to work. This doctor's still presenting on it. It makes complete sense. Yes, there is a huge gap between medical and dental still, but we got to close that. And so that's really was my mission, is to start collaborating. We talk about this collaboration with MDs and, collaborating within our profession and elevating this concept of medical billing. And that's what our company does. That's what Tips Medical Billing does, is we help practices implement this process every step of the way. There is no corner unturned. There is no challenge that's too big. But we've got to get it moving in the practice. And that takes, you know, I always say it's a marathon. It's not a sprint. It's not going to happen overnight. Clearly, you know, in dentistry, we've been taught a dental code set. Medical has a different code set. So it's not something that we've been taught. We've not been taught procedure diagnosis codes for medical. So there is some learning involved, but it's so doable. It just takes time, and it takes people getting on board with the process. We're already seeing the corners turning of certain procedures having to go to medical before dental will pay. So dental's already pushing this process, and it's going to be more and more the norm. But we still have a long ways to go. You know, you and I were talking about how dental patients, even dental patients in our profession in general has been brainwashed by this thing called dental benefits. And within that, there's a huge limitation of how often we do things, when we do things, what we charge for things, when we don't charge for things. If it's not covered, we're not going to ask the patient to pay for it. I mean, all these things. And medicine is not like that. You go to the doctor, they charge you for everything that they do. We have unlimited resources as far as how much they will pay out per year. There usually is no max as to what they will pay out per year. In dentistry, we're chasing this $1,000 to $1,500 benefit on every patient every year, and that's our goal. Like you get a little letter or an email every year towards the end of the year. Hey, schedule, you still have benefits left. Schedule. What the heck? I mean, the procedures that we're doing, it's so easy to max out a patient maximum and their dental benefits with the procedures that we're doing and the costs that they are. And then as a hygienist, what drives me crazy, we've done this beautiful work for them, and we've put in an implant, or we've done perio surgery, or whatever it might be. They're maxed out on benefits. And what do they not do? They don't come in for their preventative care because it's out of pocket. It's so backwards in everything that we believe in.
It definitely is. And it makes me think of a lot of things that I've seen throughout my career. So, you know, sometimes maybe you would have worked with a particular dentist. I'm thinking of a DSO I was at, and we had this newer dentist who came in new to the practice, and he would eat up all the benefits of that patient and then send them to hygiene after he did all this reconstructive work. And then we're just like, what in the world? Like, you know, it's like, it's not following the order of things, you know. And it clearly, we knew as hygienists, like he just wanted to do the roundhouse, or he just wanted this, and you know, any of the benefits be spent on hygiene. I've dealt with that sometimes, and the patient is suffering because the foundation of everything that was healthy. I was
and how often does a general dentist not sometimes refer to the specialist because of that? I mean, in perio, by the time we got the patient, the prognosis was poor for their teeth.
Yeah.
And I think it's this limiting belief of, well, if I send them to the specialist, one, they're going to steal my patient, and they're only going to want to see the periodontist. That happened to me a lot, where patients only wanted to see me because of the care I was providing to them, and they didn't want to go back to their general dentist. So it does happen. Obviously, we never encouraged that. We always wanted them to go and be, you know, sure that their restorative needs were met. But, you know, there's this division even within our profession of, I don't want to send them to the specialist because then their benefits are going to get maxed, yet maybe the dentist that's in that, the general dentist, isn't able to truly treat the patient to the highest level that they could. So it's a cyclic deal. It just doesn't even, the longer I'm in medical, on the medical side of things, the less I understand dentistry and how it functions and works. It just doesn't make any sense with where we are today and all the procedures that we're providing in a general dental practice.
So do you have any different courses that you could recommend an attendee if they were interested in pursuing this field that they should follow? Should they take that similar course? Do they go to school for medical coding? What do you recommend that they do? I know that on your your information, you have some different resources that you're able to give out.
Yeah.
I'll have that in the workbook, but what do you think would be the best path for them to do to investigate further?
Yeah, I mean, our niche is really that one-on-one implementation in dental practices. That's what I've built my business on, as far as learning it. And that's what I do is that, I teach my practices all the nuts and bolts of this process. I feel like there's very few companies like mine. There are a lot of companies that are doing, 2-day immersion courses, but then there's not a lot of follow-up to that. So, that's where I come into the practice and help with that process. There are, I mean, you can go and be a medical certified coder and things like that. The problem with that is that you're studying the entire body. And for me, I don't want to, I mean, I understand the connection, but I don't want to have to learn how to code for an ACL or a knee replacement. I don't care about that. I do, but I don't. It's not, you would be learning a lot of information that doesn't pertain to dental.
So like you do coding for like sleep apnea, like the different
Mhm.
oral obstructive devices, things like that, or frenectomy. I'm just thinking what I know,
Sure.
but you do
Yeah.
all the different procedures out there.
Mhm.
To make sure the patient can get some benefits. I think I was talking to you
Right.
this year when I was at the conference with you, and I was like, yeah, they didn't pay my son's frenectomy for his frenectomy and everything. But I think we were out of network, and I just went where someone had told me and everything. But what you do is so powerful and so important. So I'm going to have your information in the workbook, and definitely feel free to network with everyone in the Facebook group so that they can reach out
Absolutely.
and get more information and see contact with you even more to see what's going on if they're interested in this.
Well, and there's also a caveat to some of this as well, not even having to go out and, build your own business based on medical billing. But what if you want to bring it into the practice that you work with? There's a lot of my clients have a hygienist or a dental assistant that has the clinical background that is supporting the medical billing process within the practice, which is great because it's easier for them because they understand the anatomy, they understand the clinical side of the procedures. So it's much easier to write and understand medical necessity for people that have that clinical background. So that's another avenue is helping your practice. And if I get it, we kind of, you talk about burnout, we burn out, and or we get injured somehow, some way, and we are taken out of our clinical career. But there are things within the practice that you can bring in too, and bring in that knowledge and bring in that extra asset to the practice and for your patients. So it's not just about, learning that part. And, that's who I work with every day. I work with a lot of clinicians that are doing that within their practice and bringing extra value.
That's a good point. I really appreciate that point, because some people would, they're not ready to just be out on their own and everything. They can't do clinical for whatever reasons. Maybe it's burned out. Maybe they have some issues with their body at this point where they physically can't do it. But the practice, if they have a practice that values what they're able to do and the dollars they're able to bring into the office, then that's something that really can, help motivate the owner to help them out and, show value and what they're doing and how they're bringing more productivity into the office by being able to code these different procedures that they're trying to do
Yep.
instead of giving it away for free, like you said.
Yeah. Yeah. I mean, because it is a niche, and practices are always looking for the right person, but they might have the right person right in their own practice already.
Yeah,
You
good.
just have to bring the idea around.
Great information. Thank you so much,
You're
Kendra, for
welcome.
being here. I totally
Thank
appreciate
you.
it, and we will make sure they connect with you further. Take care.
Great. Thank you.